Hi everyone. Now we are going to learn about ophthalmic artery. This artery and the optic nerve, which we are going to study later, they are not as easy as compared to extraocular muscles. So what I usually ask my students is to just see the lecture like a movie. You just have to sit back, relax, and enjoy the lecture. You have to see the picture, register that very clearly in your mind, and then get all the content going through your ears. And after the lecture, you try to close it and just draw how much ever you're able to recall, right? So at that time you will figure out, okay, what content you're missing, what are the structures you're not able to recall. Then what you can do is just focus on those structures, and then you'll get it easily. This way we don't have to reload the brain again and again, like starting to read from the beginning again in the books, right? So let's begin. So ophthalmic artery is basically a branch of internal carotid artery. As we all know, the head and neck region is supplied by common carotid artery, which lies in the neck region. It is going to divide into internal and external carotid artery. Internal carotid artery is going to supply all the structures lying within the cranial cavity. That's why it's called as internal carotid artery. Whereas external carotid artery is going to supply the structures lying externally in the face, in the neck region, all that. Okay. But eye is lying outside the cranial cavity. Then how come it's getting supply from the internal carotid artery? The reason is embryological basis of the development of optic nerve and the retina. We consider that optic nerve and retina is an extension of the brain itself. That's why it's getting a branch from internal carotid artery. Remember that. Next, let's go through this picture. So here we can see this is the superior view of the cranial cavity. This is the anterior cranial cavity. This is the middle cranial cavity. As you can see, here we have the eyeball in the orbit and the optic nerve here. And here we can see this portion and this region. So if you know, this region is the pituitary fossa where the pituitary gland is going to lie. And just lateral to that, we have this internal carotid artery. So if you remember from the base of the skull, through which foramen does internal carotid artery enter the cranial cavity? Through the carotid canal, okay? So after entering into the carotid canal, it is going to enter into the middle cranial fossa, and it's going to have a looped course. It's going to go front and then take a loop and then come back. There's going to be a bend, okay? And that loop is happening just medial to this process, which is called as anterior clinoid process, okay? It's called as anterior clinoid process. And here we can see the bend which is happening. Now, can you think of a reason why there is a bend here? Like here the artery was going, and then within the cavity, within the cavity, it's taking a bend like this. Can you think of some reason? Usually the vessels which are entering the cranial cavity, they usually have a bend. You know why? Because if we are running, okay, and our heart rate is going to be like very high, and the cardiac output is going to be very high, so the blood gushing through all the vessels is going to be more, right? So if we are going to have that much pressure change within the blood vessels of the brain, is that good? No, right? So in order to dampen these pressure, like if there is going to be a bend, even if there is like gushing of blood, what will happen? That bend is going to dampen the pressure within the blood vessel. All right, that way it can stabilize the flow of blood. So that's how we are having a bend here. That's why. Then this ophthalmic artery is arising directly from the internal carotid artery, and then it's entering this opening, which is called as the optic canal. Okay, optic canal along with the optic nerve. But if you see, it is related inferiorly. Okay, it's traveling a little bit below, excuse me, below the optic nerve, and here it is lying a little bit inferiorly, and then it is going to cross above the optic nerve and go medially. So it's taking a turn. It's coming from below and then taking a turn and then going medially. Okay. So if somebody asks like what is the structure which is crossing the optic nerve, you should say that is ophthalmic artery. Is it crossing above the optic nerve or below the optic nerve? It is crossing above the optic nerve. So this is what we have seen. Then now this is the picture I'm talking about. Please just try to absorb this picture as much as possible. I'm just going to tell you the different branches. Okay. So Here we have the optic nerve, which is crossing the, ophthalmic artery, which is crossing the optic nerve from lateral to medial aspect. Okay. When it is crossing, do you see somebody like here? That is the first branch and the most important branch. That is called as the central retinal artery. Okay. That is central retinal artery. As you can see here, it is disappearing. Why? Because it's going to pierce the sheath covering the optic nerve. That is the dura mater covering the optic nerve. It's going to pierce and it will travel in the middle of the optic nerve to go within and enter the retina and give out many branches to supply the retina. That is the first branch. Next, we have this branch. Do you see this one, which is going laterally? On top of which muscle is it traveling? The lateral rectus. So here we can see it is traveling above the lateral rectus and directly going for the lacrimal gland. So can I name this vessel as lacrimal artery? Yeah. So this is the lacrimal artery. And while going along, this lacrimal artery is also going to give some other branches, which is a muscular branch for this lateral rectus muscle, number one. And then it is going forward and it is going to give some zygomatic branches to the zygomatic bone. And then it is going and landing in the lacrimal artery where it is going to supply. And then in addition, it is going to give rise to lateral palpebral artery for the eyelids. Okay, just below the structure we have the eyelids, right? So these are the branches. Okay, just pause the video here and please go back and revise these branches once. Try to recall it. Next, medially, this ophthalmic artery is going to continue. Okay, while continuing, the first branches that it is giving is these arteries called posterior ciliary arteries. Here we can see these long branches are posterior ciliary arteries, which is going to pierce and enter the eyeball and it is going to supply all the ciliary muscles. Next, here we can see the continuation medially and it is giving all the muscular branches to the muscle, whoever it's traveling with. That is, here we can see the superior oblique muscle. Like, can you see this pulley? So this is the superior oblique muscle which has been cut to expose this vessel. Then below this we have this medial rectus muscle. So it's like sandwiched between the superior oblique and the medial rectus muscle. Now what's happening? And it is moving forward and on the way it is giving rise to one more branch, which is called as supraorbital artery. Supraorbital artery. It is going to go and exit in this region, in just above the supraorbital margin through the supraorbital foramen or notch. Next, after this, it's moving forward, giving rise to two branches to a common place. This place is going to have ethmoid bone. Okay, there is going to be a lot of ethmoidal air cells within it. So for them, we have this branch, anterior and posterior ethmoidal arteries. Then it is moving forward below this pulley and then finally it is giving rise to one more branch, that is medial palpebral artery for the medial aspect of the upper eyelid. Okay, that's why it's called as palpebral artery. Next, finally it is going to end by dividing into two branches. One as dorsal nasal artery for the dorsum of the nose and then the supratrochlear artery which is going to come out through the supratrochlear notch or foramen. Okay. So this is the entire course. It's like actually very simple. Everything is just about like learning the branches and it's a little bit of its relations. Okay. So here in this picture, we can see these branches. Like, can you try and guess who they are? Number one, this one to the dorsum of the nose. This is dorsal nasal artery. Then we are having this and this, that is supratrochlear and supraorbital vessels. And here, can you see this is the framework of the upper and the lower eyelids? And this is the medial palpebral artery. This is the lateral palpebral artery, which was a branch of the lacrimal artery. So they are going to come and anastomose in the upper eyelid, right? So I told you central retinal artery is very, very important. Why is that? You know, because as you can see in this picture, like this is the internal carotid artery, ophthalmic artery. From that, this central retinal artery was entering the optic nerve and finally landing in this retina, and it's giving branches to the retina, right? The problem here is it's an end artery. Okay, end artery means it does not have anastomosis with any other vessel. So if that artery is going to be blocked, what will happen? That vessel is going to not get further blood supply and that region is going to die. Okay, so this vessel block is one of the common reasons, not common, but it is definitely one of the reasons if the patient is having sudden loss of vision. Okay, if the patient is having unilateral sudden loss of vision in one eye, one of the things you should think is the retinal artery occlusion. Okay, and how can we see that retinal vessels, like how can we examine them? And I'm sure you must have seen or you must have encountered an ophthalmologist like examining your eye like this through an ophthalmoscope. Okay, so what they're doing is they're trying to see within the eyeball and see the retina, where we can see the branches of the central retinal artery. So with this we can figure out if there is any pathology in the retina or within the blood vessels. Okay, and one more interesting thing here about the central retinal artery is, as we know, it is arising from this internal carotid artery. Now you guys tell me, if there is going to be an increased pressure in the vascular system within the cranial cavity, will that reflect in the uh, retinal branches in the retina? Yes. Okay, so here, as we can see, there can be increased pulsations. We can see the different changes in the vessels in the through fundoscope itself. Like basically, you can simply examine through a fundoscope and see if there are any like too much of pulsations or if there is any increased pressure changes. That way, you can easily infer that there is some pressure changes within the cranial cavity vasculature. There is increased pressure in the internal carotid artery. So this way, it's one of the non-invasive procedures to easily figure out the intracranial pressure, not intracranial, intracranial vasculature's pressure. Okay. So now let's go for this question. We have a hypertensive elderly patient. Okay, why they have mentioned hypertensive? Because in many hypertensive and diabetic patients, retinal changes are like very, very common. And here hypertensive because it's going to be a pressure change related to vasculature. So we have this hypertensive patient and they are having suddenly loses vision in one eye. Fundoscopy shows a cherry red spot. It's one of the classical signs. Which artery is occluded? Okay, so now I want you to find out the answer. It's very easy. That is central retinal artery. And now, during endoscopic sinus surgery, a surgeon accidentally injures the anterior ethmoidal artery. This artery is a branch of, this is again a very, very simple one. It's a branch of ophthalmic artery. Now moving on to the ophthalmic veins. Okay, so here again, now take some time with this picture now. Here we can see the eyeball and we are having this vein and this vein. Okay, this is called as superior ophthalmic vein. This is inferior ophthalmic vein. And these ophthalmic veins are having communication with the veins of the face anteriorly, and posteriorly it is going to drain into someone really important, that is cavernous sinus. Okay, and these vessels are like very tricky. You know why? Because these veins do not have valves, they are valveless. Usually when there is a vein, when there are veins in the lower limbs, we have valves, so that what happens is there can be prevention of entry of a blood clot. Okay, but here if there is going to be any infection here or any thrombus or emboli, whatever it is, if it is going to spread, this is going to give way for that spread into the cavernous sinus. That infection might spread easily from the face into the cavernous sinus, easily become as cavernous sinus thrombosis. Okay, next, in the inferior ophthalmic vein, we can see it is having communication with the pterygoid plexus of veins. Like, can you orient with this picture? So this is the nose. Behind the nose, this is the maxilla bone. Okay, behind the nose, this is the maxilla bone. Within the maxilla, we are having this cavity, which is nothing but maxillary air sinus. Okay, so we have like air sinus in all the parts of the bone in the face, right? So in the maxilla, we have maxillary air sinus, and just behind that, we are having this plexus called pterygoid venous plexus. So this is taking communication with them, inferior ophthalmic vein, and again it is going to drain into the cavernous sinus through the superior orbital fissure. Okay, so again these veins are important because they are valveless and they are communicating the superficial veins with the deep veins within the cranial cavity, right? So this is regarding the veins. All right, thank you so much for watching. If you have any doubts, you can post it in the comments, and thank you. Bye.